This is a very important meeting because for the first time in history, it will produce guidelines and recommendations for men's health maintenance and prevention of disease. Guidelines that are also age-specific. That means guidelines how to maintain health in early age, in middle age, and in late age, because there are specific needs for each age and there are specific issues for each age. We have a group of key opinion leaders in primary care and in different specialties, ranging from urology to cardiology to endocrinology, mental health, and others. In addition, our multidisciplinary panel is international. So we have representatives from the United States, from Europe, from Latin America, from Asia. So this really gives our consensus conference a multi-specialty and primary care diversity, in addition to a national and global perspective.
10 years ago, when the International Society for Men's Health was founded, everybody knew what women's health is about, but nobody knew why is there a necessity of men's health and what is men's health. Now, whether you talk to the World Health Organization, the WHO, or other organizations, or even the European Commission, men's health is acknowledged and there is funding for research and to look into the differences and why men have lower life expectancies and have higher morbidities and mortality. A comprehensive guideline for the maintenance of men's health does not exist because until recently a lot of people did not believe in the importance of men's health, and gender medicine always meant women's health.
I think that society, for the most part, including myself before today, that do not have a clue about what men's health is. I think ISMH has to do a sort of a awareness campaign to inform our clinicians, health workers, public health practitioners, researchers on what we really mean by men's health.
Men in general are very poor evaluators to come and seek treatment for their own health until they feel that they truly require treatment.
The global approach is very important, and we try by the tasks and missions of International Society of Men's Health to establish national societies affiliated with the international societies to improve the situation and to have the global approach to men's health and to create programs in terms of preventing diseases and the therapy as well.
This conference is hugely important and in fact probably wouldn't have occurred 10 years ago because men's health actually didn't receive that much attention. But here we are actually discussing recommendations, solid recommendations upon which primary care physicians and for that matter workers within primary care per se can actually act upon to improve the health of men. There are huge differences in men's health across the world. For instance, the average life expectancy for men in Russia is only 59 years and has declined over the past 10 to 15 years. But then again, in East Glasgow, Scotland, life expectancy of men is 54 years. So where you would expect maybe men's life expectancy to be high, in fact, we find pockets of men's health, which is really very poor indeed. So it's not the same across the world.
And in Asia, it's such a diverse country with so many cultures and so many different standards of living and socio-economic status. There is very big issues. So even the most countries like Japan still have an issue of the men suffering higher mortality and morbidity compared to the woman. And of course, in the poorer countries like Indonesia, the discrepancy is much higher. Now, we literally have hardly anybody in Asia that promotes men's health. If we don't keep men healthy, especially start thinking about keeping the middle-aged men or even younger healthy, we will suffer a tremendous decline in workforce. And economically, I think the whole Asia will suffer.
Part of the problem that we have is convincing politicians, health professionals and the deliverers of healthcare that it is actually a very good idea to address men's health. Politicians have to be convinced that it makes sense to look after men's health, even if it's only on an economic basis. But the true answer to all of this will be to address the misery that's out there for both men and women from the poor state of men's health in many parts of the world.
The Collins Center has been working on the question of men's health for about 7 years now. And we, based on having done some work in distressed neighborhoods, looking at what the predicaments of men really are, finding out, for instance, that 2 out of 3 in one of the neighborhoods has an incarceration history. 30% are using the ER as their primary health facility, the emergency room. Only 1 in 5 had had dental care in the previous year. That motivated us to begin a conversation that became national and then ultimately global about poverty and the social determinants of men's health and what is happening and not happening.
We're not teaching medical students about men's health. We're not teaching residents about men's health. What's important to propagate the next pipeline of physicians coming out into the world is to have them have the tools and guidelines to be able to take good care of men. There's too many guidelines and there's not enough time once you actually get a man into the doctor's office. So what our group seems to want to do best is to work through this and come up with a unified set of guidelines and tools for most physicians to be able to use, recognizing that there are differences in populations, recognizing that not all men are equal across the globe, but at least this is a very unique and novel starting point, which right now doesn't exist.
We had a tremendous exchange over a great deal of information, ranging from cardiovascular risk and mortality in all populations, whether including minorities and different ethnicities, to prostate cancer and other genitourinary carcinomas that afflict men, to post-traumatic stress syndrome, to depression in men, to cognitive decline in men, to HIV risk in men. And we've really spent a great deal of time elaborating that discussion.
We're now seeing an increase in the awareness of men's health. If we can keep that going, we are now going to see some of that disparity, as you've called it, reducing. If we don't see an increase in investment in men's health, both in terms of investment, monetary investment, but also interest, then we will see that disparity continue.
Men's health movement can take pages from the women's health care movement, particularly in terms of political advocacy. Right now, and for the past 6 or 7 years, the NCI invests about twice as much money in breast cancer research as it does in prostate cancer research. And prostate cancer is somewhat more common than breast cancer and kills a similar number of individuals. And so that's one of the disparities that we would like to address.
Men's health issues have tended to take a back seat when it comes to gender, I think largely because men tend to be deniers and ignorers, and we feel that we don't want to know about it. And one of the things that's important in terms of advocating for men's health is to motivate men themselves to get into the doctor and be screened for various conditions and learn about what they can do to live a healthier lifestyle so that they can live longer. One of them is to avoid overeating and obesity. Another is to avoid tobacco of any kind. Another is to make sure that your fat levels and lipids are in order. Another is to take an aspirin a day over a certain age. And another, which you may not know about, is to get your teeth cleaned regularly. There's evidence to show that if your teeth and gums are infected with bacteria, that may impact your mortality.
Men often do not see a doctor between age 20 and age 50. Women have a gynecologist, they deliver babies, they pay attention to their health. By the time a man is 50 and has erectile dysfunction or hypertension or diabetes, he really has missed 10 or 15 or 20 years of lifestyle changes, diet, exercise, to reverse that.
I think we will solve the issues around men's health when we come together globally, that is with partners from around the world, and establish some standards for what we should do when men approach us for health care, but also what we need to do to go out and find men and get them into care. Because after so many years, particularly in the United States, if you're poor and you don't have health coverage, the last thing you're going to do is go to a physician and get a bill that you can't pay that may put you into collections and make you go into bankruptcy. So we've got an opportunity here with all of these partners to, one, develop the checklist for what should happen when men are seen by healthcare providers, but also to set up a system that says, we're not going to let you stay out there and get so sick that then it becomes a huge problem and expense for the entire community, when in fact we can have an outreach worker or somebody go and find you, give you health education, and get you where you need to be.